Question 101. Lymph drainage of lower limb and adjoining part of trunk. Lymph vessels of the free lower limb are divided into superficial and deep vessels. The deep vessels accompany the femoral artery and its branches, and you can see the popliteal lymph nodes around the popliteal artery and vein. Now the superficial lymph vessels accompany the saphenous veins, the great saphenous vein. The vessels accompanying the great saphenous vein are called the medial group. They ascend and terminate into the inferior nodes. And then you have the lateral group, which ascends along the small saphenous vein and ends partly in the popliteal nodes and in the inferior nodes. And then we have the superficial and deep inguinal nodes. The superficial inguinal lymph nodes are divided into the upper group and the lower group. The upper group receives lymph vessels from the gluteal region, from the lateral abdominal wall, the anterior abdominal wall, the external genital organs, the uterus, and the lower part of anal canal. The lower group receives superficial lymph vessels from the free lower limb. The lymph from the superficial lymph nodes is drained into the external iliac lymph nodes, here, and into the deep inguinal lymph nodes. The deep inguinal lymph nodes are placed around the femoral vessels in the femoral triangle near the inguinal ligament, and they receive lymph from the deep lymph vessels of lower limb and from the uterus along the round ligament of the uterus, and the efferent lymph vessels arising from the deep lymph nodes terminate in the external iliac lymph nodes.